We will move on to then translating principle into the actual practice. And because of the time, I won't be able to articulate in full our treatment process or treatment model per se, but I'm delighted to share with you some forms of Morita Therapy practice, or models, if you will. Let me begin with the note that there are two forms of Morita Therapy. One is what we call inpatient Morita Therapy, and the other is outpatient, in and out. So inpatient Morita Therapy is often termed as residential Morita Therapy because it happens in a residential setting. As you saw in Morita's original treatment, he opened his own house. So because of that, in and residential is attached to it. And we refer to that as classical Morita therapist. So that's how Morita Sensei has started. And it is original Morita therapy. It's practiced today in specialized hospital settings in Japan because it requires the certain facilities and staffing. And the other form is the outpatient Morita therapy, which is becoming more and more popular. We have various models and approaches are available, and it's practiced in, and it can be practiced in various settings. For example, hospitals and private clinics, community clinics, universities and schools, and industrial and organizational sectors, and it is often also long practiced or applied in self-help groups. So we have in Japan, Seikatsu no Hakkenkai. It's the self-help group developed and run by the previous patients or current patients of Morita Therapy, which is our great asset in Morita Therapy. So let me introduce to you, there are two forms of Morita Therapy. The original inpatient Morita Therapy, as I mentioned, Morita called it my special treatment for Shinkei-shitsu. And I think it's very special that patients get to live in Sensei's house and seeking guidance 24/7, so to speak. But bear in mind that he's looking into the treatment of personality trait, which is persistent, which requires more extensive form of therapy. So that's the rationale behind Morita moving into more residential milieu or ecology of change. So this is second floor of his house where Morita Sensei actually lived and heard the patient hearing them. I heard this episode that one day he was hearing the patient sweeping the floor, and Shinkei-shitsu patient, they swipe the floor so perfectionistically and so tightly and quickly and forcefully, and then Morita Sensei comes out and advises to perhaps relax and do your best and try your best, not aiming for the perfection. So that's the milieu that allowed for Morita Sensei to give guidance and advice to the Shinkei-shitsu patient and client there and then in the ecology that happens. And original Morita Therapy has 4 stages. It can be done completely speechlessly. Stage 1, patients and client go through bed rest therapy. So that's the typical Morita Therapy inpatient facility, and that photo is a courtesy of GK University Center for Morita Therapy. So patients and clients are advised to rest. And stage number 2, then after the rest, they go through light occupational therapy, and stage 3 is heavy occupational therapy, and then stage 4 is complex actual daily living phase, which basically means that patients and clients goes back to their work or school from hospital. Gradual reintegration back to the real world. So that's the structure of inpatient Morita Therapy. And each stage has its aim and function to it, which I will try to unpack. So stage 1 bed rest therapy. And using Morita's word, it typically requires 1 week. And in Morita's word, it's a sudden liberation without tampering. It's Hanmonsoku Kedatsu. And we're aiming for patients are required to lie in a futon and rest and sleep. And they're fed balanced meal 3 times a day in a room. And they are allowed to go to the toilet. And they receive 5 to 10 minutes of visit and consultations by Morita therapists to check in to see how they are resting. And this is a very, very distinct way of trying to get clients and patients to rest, which in Morita therapy is very, very important. It is intended to reignite and revitalize their desire for life. Often in a form of boredom. Is the most often times what happens is that patients with Shinkeitsu, they can't lie 1 week straight. They started to jitter and start to get bored, but we are seeing the desire for life springing. And also they're experiencing their revitalizing desire for life. And for someone who has a panic disorder or something, their panic episode might be developing, but they will bodily gain that no matter how hard they try, that they are not having a heart attack, which they fear that their panic attack may be the sign of. So it's a design so that they can bodily gain that what they're fearing is not happening in that setting. Difficult to articulate, but one point that I want to highlight is that there's a difference between therapeutically containing the client and patient versus abandoning them or ignoring them. This is a highly contained environment therapeutically. There's a 24/7 care of the doctors and nurses to make sure that they are resting and their desire for life is being revitalized. And this form of residential and inpatient treatment is quite rare in our psychotherapy industry, but this is specifically designed for the treatment of Shinkeitsu, knowing that these patients have Shinkeitsu trait. Because of that reason, we value assessment, we emphasize assessment. It's almost like if you don't have Shinkeitsu, and then you're not eligible or suited for this form of therapy. So we assess very carefully to ensure that a patient will benefit in the maximum potential from this form of treatment, specifically designed for Shinkeitsu. So I wanted to highlight that this is a therapeutically contained environment. It is not that we are abandoning them. And after their desire for life is revitalized and rest is coming in, body is rested, mind's rested. Remember the body, mind, the one is rested. And then we will channel into the next phase. But the most purpose of, again, stage 1 is this: we don't interfere. The body, mind's best course of healing is that we assume that if left unexacerbated, and the body mind will heal itself. Again, I mentioned therapeutic containment and abandonment and neglect is different, and experienced Morita therapists, we silently attune to the needs of the patient and client, and we promote uninterfered potentiation of body-mind's recuperation. For example, when you catch a flu or cold or like a COVID, sometimes, yes, you could take some medications, but nothing beats the rest and recuperation. And it's a similar salutogenic kind of revitalization we are aiming for. And it results in physical energy, psychological energy. Again, those two are the same. And the goal is to revitalize the desire for life. And then we will channel that desire that is reactivated into a gradual occupational work, not bringing them to a full-blown sport or heavy activity. We'll gradually channel this desire for life into stage 2. Because we're also aware that Shinkeitsu client or patient try to do their best, which usually means try to do too much. So we help them to regulate, pace themselves, beginning with light occupational work. It promotes spontaneous activities. It's meant to breaking down the feeling-centered attitude and refocus on the importance of action. And stage number 3, we will introduce heavy occupational therapy. So this is a garden in the GK University Center for Morita Therapy, courtesy of. So these are a garden in which the Morita patients and clients are doing occupational therapy. The purpose of stage 2 and 3 is the gradual channeling of life energy, as I mentioned, desire for life, emerged in stage 1 to purposeful day-to-day activities and interactions. Stage 1 focuses on upper body, higher than your waist, and then stage 3 focuses on entire body. As you could see, it's a gradual channeling of taking action, desire for life to taking action. And stage 3, 2 and 3, another distinction is that stage 2 is done individually to help them pace themselves again, and they'll start to work in group. And stage 4 is complex actual daily living, and then clients and patients are supported to reintegrate themselves back into the actual day-to-day living. But mind you, as you could tell from this photo, real life is very busy. It's very, very demanding. So we pay attention to the gradual channeling of it. And even vice versa, it must be very difficult in modern day us to be living in this very busy, so demanding world. So at least in a therapeutically contained environment, we help patients pace themselves, or maybe perhaps getting to know their pace for the first time. Maybe I was doing too much. Maybe this is as much as I could handle, and that is okay. And small step is okay, as long as we are focused on the action taking. And Morita focuses on the pure mind, which he means to be uncomplicated, to mean that to feel it. For example, many of the clients who are first going back to the complex actual day-to-day living, they may get overwhelmed, but be overwhelmed. And it is what it is. That is how it's going to be. And they need to feel, and we should create a room for them to feel overwhelmed. Is it okay if someone can be overwhelmed? That is completely okay. So in a way, we are promoting a meta-attitude towards the feeling and say, it's okay to feel overwhelmed. It's okay to feel very anxious going back to this crowded street. I would feel really anxious going back there as well. So we promote pure mind, being uncomplicated to what is. So now let us move on to introducing to you some of the models of outpatient Morita therapy. And today I'm going to be introducing to you the guidelines for practicing outpatient Morita therapy, published by Nakamura et al. And Japanese Society for Morita Therapy, and the Diamond Model published by myself in 2013. So before we share a little bit about each model, I'd like to talk a little bit about the background from in to out, emergence of the outpatient Morita. And as I mentioned, it was response to the contextual demand of modern day practice context. It's because residential and inpatient facilities are costly under Japanese healthcare, and because of the changing healthcare landscape, we need to respond to it. And many of the Morita therapists also had started applying principles of Morita therapy, cultivated first in residential setting, into their outpatient practices. It proliferated. So we engaged in guidelinizing of Morita therapy, outpatient Morita therapy. So it's a response to the contextual demand and also internationalization. Many of the Morita therapists went overseas, first with China, and we disseminated Morita therapy, and Morita therapy is proliferating overseas as well. So that was also behind the force behind this movement from in to out. Classical debate, could we, should we, and would we? What I mean by that is if you take Morita therapy from inpatient to outpatient, would you still be able to call that a Morita therapy? And I've consulted many of the senior Morita therapists, and most of them said that Morita himself practiced the outpatient form as well. And again, the standard edition of the collected works of Morita Shoma includes his correspondent therapy, his outpatient practicing records. So they are available. So Morita himself has done it anyways. So we learn from that to practice in a form of outpatient. The establishment of the guidelines for practicing outpatient Morita therapy was led by a Japanese Society for Morita Therapy, led by Dr. Nakamura. And this is also facilitated by and also leading the way of advancing our endeavor to respond to the EBM evidence-based movement. Right now, Japanese Society for Morita Therapy has a working group who's conducting a large, fully powered, randomized, controlled trial of Morita therapy for anxiety and OCD disorders. And so this is also a tool advancing our evidence-based movement in Morita therapy. So these are the overview of guidelines for practicing outpatient Morita therapy. These are the table of contents, which I don't have a time to go over in detail, but they are available. And there is the Morita therapy, outpatient Morita therapy treatment protocol. This is called the Diamond Model, which I have worked on mostly with the colleagues from England. Guidelines published by the Japanese Society for Morita Therapy was described at the level of principle and introduction of few strategies. And some of the clinicians called for more detailed version of how shall we operationalize these principles into the therapeutics or the therapeutic techniques, or perhaps using a case study or in verbatim, how we may be able to apply the principle in a way of what can we say to our client and what can we or what should we not say to the client, and how might we facilitate the change in the client. So there's a need for more concrete protocolization of the Morita therapy, which I have worked on in 2013 and published the Diamond Model Protocol, which includes 8 modes, if you will, including Morita therapeutic principles, and then the mode switches depending on what the client and patients say. So it is a model designed to respond to the flow of client and patients, therefore the diamond shape. This is not linearly designed, so this diamond algorithm will follow and respond to the client movement in a manner that is flexible. But anyways, so this protocol is available and used for clinical trial purposes. And extending range of application. So this is proposed by the guidelines of practicing outpatient Morita therapy. So these are a list of the range of application of outpatient Morita therapy. We have depressive disorders, anxiety and OCD, trauma and stress related disorders, and somatic symptom and related disorders, and Shinkei-shitsu, of course, the original treatment is designed for, and it can be practiced in various settings, like medical settings, in psychiatry, and often practiced in psycho-oncology by Dr. Itami's primary work, dermatology, dentistry, and bariatrics. One of my colleagues in Australia applied Morita therapy to bariatrics for people struggling with chronic conditions. And it's been practiced in community settings, such as private clinics, school counseling, family therapy, and career counseling. Well, thank you very much for listening.